So we've been working on this project, as Peter says, since the beginning of the year, and the purpose of the research was to look at the main challenges and considerations for the fire and rescue service moving forward. As I'm sure most people here today are aware, there have been severe budget cuts in both the revenue support grant and through council tax that are eating into the fire service's capacity. There's a predicted gap in funding of 17.5 million, or 24% from a typical single authority by the end of the decade, with the total shortfall for all services estimated at 600 million. So this poses questions about the viability of individual fire services. In addition to this, there's been a steady fall in the number of fires, so 40% over the last decade. Both of these issues have shifted the focus of the fire service and opened up new questions about the purpose of the fire and rescue service. Austerity has highlighted the need for change, but there's a hotly contested debate about how best to do this. Some advocate frontline cuts, others have called for mergers of individual services, and some champion the integration of all emergency services, perhaps under the leadership of police and crime commissioners or city mayors. So what is the future for the fire service? Clearly, the fire service's operational priority will always be to respond to fire and rescue incidents, but the service needs to make a strategic choice. It can become more efficient and streamlined service responding solely to fires, which would mean a reduction in the number of full-time paid staff. Or alternatively, the service could maintain slightly higher staffing levels, but develop considerably the work with other public services and widen their prevention agenda. We believe this to be the most effective pathway. The service has become highly skilled at targeting specific communities, vulnerable groups and businesses at risk. The prevention work carried out by the service is bolstered and enabled by its reputation as a trusted organisation. And given the strain that health and social care organisations are under and the move towards early intervention by these services, the fire service could be a great support to other public services by widening their prevention agenda. So we looked a little closer at community intervention work. And as you'll see there's a quote from one of the people we interviewed that says, "There's a sense that the service can be the eyes and ears of the whole community and be the glue that brings everyone together." I can't actually read that, I hope I've remembered it properly. So some services are actually beginning to do this. Essex County Fire and Rescue Service run a fire break scheme for 10 to 24-year-olds that aims to reduce the risky lifestyle choices of some young people and raise awareness of the consequences of fire. Humberside Fire and Rescue Service leads their frailty and isolation work stream for Hull 2020, which is where all the public services are working together, where elderly patients who live alone are having cold alarms installed in their property, and when the temperature falls below 16 degrees, an alarm is triggered and a response team will check on that person to make sure they're okay. We also case studied Greater Manchester Fire and Rescue Service, which I'm sure Jeff will tell you a lot more about, and looked at their community risk and intervention team in detail in the report. The CRIT, so the Community Risk and Intervention Team, which is called CRIT for short, work with social care teams in Manchester to help them respond and access to those in need much earlier than they previously would. So they might identify vulnerable people in the community and let social care departments know, and then can also help to fit things like handrails if that's what people need. Inevitably, there are some difficulties in working this way, and we detail these in the report with suggested solutions. And also, inevitably, the biggest obstacle to overcome is probably how to fund this model. We suggest whole place community budgets as a potential solution. What became increasingly apparent when we were carrying out the research was that if greater community intervention was the way forward for the fire and rescue service, then the vision needed to be thought of when discussing other matters like who the service should collaborate with or what the optimum size for the service is, as ultimately these would affect their ability to deliver on the preventative agenda. So briefly, I'm going to look at collaborating or working with other emergency services, and then on to sort of optimum scale for the fire service. So all fire and rescue services work with other emergency services on a daily basis, responding to major incidents. But many of those that we interviewed felt there was obvious opportunities for the fire and rescue service to improve outcomes by working more closely with these groups. However, many that we spoke to also wanted to stress the point that emergency services are not all the same. As you can see there, an interviewee said, "I caution against seeing all blue light services as the same. Culturally, organisationally, the purpose is quite different. The FRS is held in high regard within the community. I question whether the fire and rescue service's standing and neutrality would be affected." So in particular, people were nervous of the fire and rescue service collaborating with the police. The Fire and Rescue Service is a very strong, trusted brand, and it's this brand that helps them gain access to the vulnerable people in the community. It was felt that joint working with the police could endanger this, particularly if it involved firefighters responding directly to criminal activity or crimes. Instead, the focus should be on alleviating some of the capacity issues faced by the ambulance trusts. Hampshire in particular has a very good model of corresponding with their ambulance service, and this is case studied in the report in more detail. Firefighters are often used in rural areas to respond to incidents before the ambulance can get there. And also in Manchester, the CRIT team can be called on to deal with non-urgent cases to ensure that, for instance, people who have fallen over don't have to wait too long for medical attention and therefore deteriorate. And looking again briefly at greater efficiencies within the fire service. So throughout our research, there did seem to be consensus that there are currently too many fire services in England and that efficiencies could be saved through mergers, while outcomes also improved. However, it probably comes no surprise that there was little consensus about the correct scale for the fire service in England. There are many advantages to merging or collaborating with other fire and rescue services. For example, efficiencies can be saved by sharing back office or collaborating on all aspects of procurement and save money as well as time. And there's also an advantage to working more closely with other services as you can standardise training, and it's a good way to exchange knowledge. So given all these advantages, when thinking for the optimum scale for the service, we tried to think about it both operationally and organisationally. So organisationally, a national fire and rescue service would seem intuitive, as all the advantages of sharing services would be maximised. However, operationally, with a national fire and rescue service comes the very real possibility that local knowledge and relationships will be lost, the very things that make the fire and rescue service so good at community intervention. So if the fire and rescue service is to work on the health and social care prevention agenda in their local areas and tailor their service to the specific needs of the community, they will need a level of local autonomy over their own operations and priorities. So what we propose in the report is exploring the option of a national organisation that will create efficiencies of scale by bringing together services such as back office and also act as a knowledge hub. But it's also vitally important that current local fire and rescue services are maintained on a similar scale to present day, so that they can take on a more integral community role. So just a recap on the recommendations briefly in the report. Our vision of the fire and rescue service of the future is one of fire service working and widening their preventative agenda and working on community intervention, particularly in health and social care. So what we recommend to central government is to legislate to enshrine the vision of the fire and rescue service as organisations of community safety and well-being. So not only does that mean that all fire services will have an onus on them to do community health and well-being, safety and well-being, as a lot of them are doing anyway, but also that other public services working in the area will take them seriously as a vehicle, something that can work on community safety and well-being. We recommend that fire service collaborate with other emergency services, so the ambulance and the police, on preventative agendas, with a little warning of perhaps the risk in working with the police on criminal incidents. And thirdly, we recommend exploring the possibility of a national organisation to see what savings could be made, but also bearing in mind that local knowledge is still vitally important. So thank you. I look forward to hearing your comments.